Come in.
Hello, Mr. Sullivan.
Hi.
My name's Shelby. I'm a nursing student with Texas A&M University here in Corpus Christi. I'm going to go ahead and close this door for privacy. And would you mind telling me your full name and date of birth?
Cody Sullivan, 4/11/94.
Okay, very good, Mr. Sullivan. During today's visit, we are going to be doing an assessment of your ears.
Okay.
All right. For that assessment, I have a pen light so that I can see a little bit closely with good lighting. I have a ruler here, and I also have an otoscope that we'll be using later on towards the end. Following just some visual assessments, I'll be doing an auditory exam right there at the end.
Okay.
Okay. All right. If you don't mind, I think you're positioned just fine for this first portion, okay? I'm going to go ahead and get started by looking. I see that your ears are both symmetrical. The pinna, it looks like there are no lesions, no swelling. Your auricles face upward, and it looks like they are perfectly aligned with the inner canthus of your eye, which is also good. I'm going to use my ruler now to measure each ear if you don't mind. All right. About 2.5 inches on this side. And the same on this one.
That's good.
It is. Okay. All right. I'm going to look a little bit closer now, and I may start touching you, okay?
Okay.
All right. I see no tenderness here to the auricles or pinna. No tenderness to the tragus. The pre- and post-auricular lymph nodes are not palpable here. And the mastoid process, no pain there?
No.
Okay. All right, let me check this other side for you. No tenderness here. Okay, or to the tragus. Your post-auricular lymph node, non-palpable, same here. And this causes you no pain?
No pain.
Okay. All right, neither ear looks like there's any discharge and no odors, so that's good also. Okay. Can you tell me, before I go ahead and get my otoscope, how do you regularly clean your ears? Do you use a Q-tip?
I wash them in the shower and then use a Q-tip when I get out.
You do that daily?
Yeah, sometimes twice a day.
Okay. All right. It's really recommended that you not use a Q-tip. It's actually very dangerous, and it can cause impacted cerumen, which is that wax in your ear canal.
Okay. What am I supposed to use?
Well, there are a couple different devices you can get that don't involve actually pushing anything inside of your ear. And really, it's kind of natural for the wax to just slowly dissolve as it goes out. So the chances of there being too much is slim.
Okay.
Okay. All right. I'm going to grab this otoscope now and turn it on. Okay. I see the meatus is free and clear. I do see some fine cilia there, right there at the opening. I'm going to go ahead and pull your pinna up and back. And I'm going to be looking in now, okay?
Okay.
You can just sit straight normally. Okay. Okay, see a little bit of wax. Tympanic membrane that looks intact. And the cone of light looks like it is at about 10 o'clock. I'm going to be looking at the other ear.
Okay.
Okay. Fine cilia here also. Meatus looks clear. I see there are quite a few abrasions here in your ear canal on this side.
Yeah, there's been a little cut in there for like a week.
And some dry blood. You have no problems hearing on this ear?
No problems hearing. No, there's just been a cut for like a week from, I guess, a Q-tip or something. I don't know.
It looks like there's a little bit of trauma here to the tympanic membrane. The auricle looks like the cone of light looks like it's at about 4 o'clock.
Okay.
Okay. All right, now I'm going to go ahead and do that ear assessment I talked about as far as hearing.
Okay.
Okay. I'm going to go ahead and do something called a whisper test. I'm going to cover your tragus here to close off this ear, and I'm going to whisper something. You tell me what I say, okay?
Okay.
Okay.
1, 2, 3.
Okay. Same on this side.
ABC.
Very good. Okay, I'm going to go ahead and look at my note card here, make sure that we haven't missed any portion of this assessment, okay?
Okay.
I did not note the color of the tympanic membrane. Both times, gray to silverish on either side, so that was good. And that about does it, Mr. Sullivan. Thank you for your time today.
Thank you.
Mm-hmm.